Hello and welcome to GP Notebook TV. My name is Anish Kotecha and I'm a GP in South Wales. Today I thought I'd discuss with you the recent article that came out in the New England Journal of Medicine talking about the use of once weekly semaglutide for adults who are either overweight or obese. And this article was published in March of 2021. So we all know that obesity is a global health challenge. We know that we should be advocating for stringent diet and adherence to a good exercise program. But we know that just using these methods alone is difficult to achieve a sustained weight loss in our patients. And there are limited pharmacological therapies available. We know that the issue with obesity is that it's associated with insulin resistance, hypertension and dyslipidemia, and it can increase the risk of hospitalization and reduce life expectancy as well. Now, we know that semaglutide is a glucagon-like peptide 1 analog that has already got a use in type 2 diabetes and does infer some cardiovascular benefits. This article was looking at and described a randomized controlled double-blind trial which looked at the use of semaglutide for people who were either overweight or obese. Now, the article had a population that was very typical of the types of patients we're seeing in our clinics, with an average age of around 40 and already having pre-existing comorbidities. The exclusion criteria included diabetes and pancreatitis. The reason for that being we know that pancreatitis is already a contraindication for use of semaglutide. Now, the article was looking at the use of once weekly subcutaneous injections at a dose of 2.4 milligrams in this population, and the main endpoint they were looking at is whether there was a weight reduction of 5% compared to that in the placebo group. Now, what's really important to note here is that as well as receiving the semaglutide, people were also counselled about the importance of adhering to a strict diet, and they were looking at a 500 calorie deficit according to their energy expenditure, and also adhering to a strict exercise regime. Now, they also looked at other really important categories. For example, whether people were having a higher degree of weight loss, like 10 to 15%, whether it had any effect on waist circumference, systolic and diastolic blood pressure, and also a physical functioning score, which are important because they're either cardiovascular risk factors or, of course, they do impair quality of life of our patients. Now, the results were very positive indeed and showed that people in the semaglutide treatment group actually had a very good amount of weight loss, at least 5%. And this was achieved by a high proportion of the patients within that group. And results of weight loss were seen from as early as 4 weeks, which is important because people are more likely to continue with their treatment if they're seeing the results and the benefits fairly early on. Now, it also showed that people did achieve a higher amount of weight loss, the 10 to 15%, which is also really helpful to know, to be able to tell our patients. Now, let's talk a little bit about side effects. The common side effects seen were things like nausea and vomiting, as well as diarrhea or constipation. But of particular importance, these were usually mild or moderate, they were transient, and they were usually resolved without discontinuation of treatment. Now, as I said, a high proportion, around 86%, achieved the weight loss of 5%, and that's a great statistic there to be able to tell our patients, and for even us to know. Now, the article commented on the fact that semaglutide had a greater, or inferred a greater weight loss, which was sustained compared to liraglutide, which of course is the other medication that we know can cause weight loss as well. And because there's a once weekly regime, they suggested that the treatment adherence was likely to be greater. Now, in summary, I think this article has shown us that a once weekly regime of semaglutide for adults who are either overweight or obese can give us a clinically relevant, sustained, but also a significant weight reduction of at least 5% in at least 86% of patients. This is, of course, very, very good to know for us, and is very exciting news. And I think we need to be open as GPs to the fact that in the coming years, we may be prescribing this to our patients a lot more. Thank you for listening, and I hope you found this video useful. Please do continue to tune in to GP Notebook TV for further videos. Thank you.